Have you been taking the Vital-A-Down?
You may think doctors make a lot of money, but Dr. Aumatma Shah isn't like most doctors. She works full-time at this clinic in Oakland, California, and doesn't get paid a single penny.
We give with no strings attached.
Dr. Shah co-founded KarmaClinic, where patients don't have to wait in line and don't have to pay for medical care.
Something that's free is generally not valued.
She says it's not free, it's a gift.
And gift is something that I want to give you. This is what I want to offer. And it comes from a different place. It comes from this place of, I care so much about it that I want to gift it to you.
KarmaClinic's concept is simple. Dr. Shah and 3 colleagues give the gift of health.
We give the patient the respect that they deserve, regardless of whether they have money or not, because they're a human being and everyone deserves health care.
Suddenly, my life came to a screeching halt.
Luz Marina Ruiz benefits from this precious gift. She suffers from Lyme disease and was in so much pain she couldn't get out of bed.
I couldn't do anything. I couldn't do my artwork. I couldn't take care of my family or myself. So it felt devastating. And I've gone through many routes of treatment. The original was a Western protocol, antibiotics and all of that, and it really didn't work. And after months of being bedridden and not being able to care for myself, I just couldn't do it anymore.
She then saw some Eastern doctors who helped her physically heal, but she wanted to heal on a deeper level. Ruiz researched medical alternatives and wanted to see a doctor who specialized in naturopathy, the use of natural agents to heal, but she couldn't afford it.
When you're not working and you're on disability, your income is very meager and it's very hard to make ends meet.
Ruiz's doctor told her about KarmaClinic.
I just didn't really believe that.
She made an appointment online, filled out an extensive questionnaire with probing questions about her perspective on life and responsibility to heal.
Questions I've never been asked before, and the intake form was quite thorough, and I was really impressed because I thought, well, she's really listening and asking all these questions and really tuned in. I was like more alive, more alert, I could do more things, and it was kind of amazing. So my life has really changed.
The really neat thing about working with her has been that she completely takes charge of her health. So I tell her, like, this is what might support you in your healing, and she'll do it.
Many patients touched by Dr. Shah's gift of health say they're inspired to pay this gift forward.
I was overweight and had heart problems and couldn't move around very much, and now don't have really any of those problems anymore.
Okay, peace.
So why would anyone devote so much time and energy to strangers? Dr. Shah was inspired after volunteering in clinics right out of med school.
What were you feeling physically?
She believes everyone should have access to health care and feels that good karma will sustain her needs.
The vision that I had when I was pretty young was running a free clinic of some sort. So when my intuition says do this, I'm like, oh, for real? Like, you have to be kidding me. Seriously? And I resisted for a while. It's like, no, I don't think I can do this. Like, I gotta pay my bills, you know? I don't know how this is gonna work. But again and again, it was the universe saying, no, do it.
And you bring people closer to finding that.
Patients like Ruiz leave with inspiration and the medical education to take charge of their own health, along with this smile card.
It says someone reached out to you with an anonymous act of kindness. Now it's your chance to do the same. Do something nice for someone. Leave this card behind and keep the spirit going.
An important experience money can't buy.
It's opened me up in more ways than just healing. It just makes me feel like I want to be a part of that gifting community. Like I tend to help people more now than I did before.
Anonymous donations from the community allow the clinic's doors to stay open since April 2009. Miraculously, every month, just the right amount of donations come in.
I don't understand how this happens, but every single month it's like, wow, okay, our costs are covered. Great.
But this experiment is about to get harder. With no savings and no paycheck, she doesn't know how the bills will get paid. College loans are due next month. Do you ever have the fear of thinking, gosh, will I be able to pay my bills?
I have that relatively frequently.
Dr. Shah believes that the community will sustain the cost of running the clinic and her basic needs.
The truth is, I don't know. I just put it out in the universe. Like, if I'm going to do this full time, then there needs to be a way that this sustains me. Like, I just need shelter and food.
Unlike the world of academics and science, there's no formula, no explanation for how this clinic works. Dr. Shah truly believes it's just karma in action. My favorite one is leap and the net will appear.
Yes, that's kind of been my experience.
Yeah.
Leap and the net will appear.